Hi everyone. So a couple of days ago, Pfizer released their clinical trials of the vaccine in 5 to 11-year-olds, saying that it was very effective and safe. And so I'll go over that trial in another video, but basically that made me wonder how dangerous is COVID in kids 5 to 11? We all generally know that COVID is very safe in young children. They mostly have asymptomatic or very mild disease, but a few of them do get sick, and I wanted to know exactly what are the numbers and does the risk benefit profile work out that vaccinating kids 5 to 11 is a good idea? And so, in order to make a good assessment of that, we need to know what the risk of COVID for these kids are. So, in this video, I'm going to go over the American Academy of Pediatrics high level data and then go over what kids are more likely to have a severe disease and then look at what the rates of long COVID in children are. Um, so let's get started. The American Academy of Pediatrics puts out a weekly report on state level data, and you can go, I'll link, as in all the videos, I'll link all of these below in the description so that you can check it out for yourself. So I'm going to look at this full report from last week, and it's right here. And this is pretty interesting to look through. All right, so they just gather all the data in children up to age 18 from all the different states. So this figure is the total number of COVID cases, and you can see California has the most, Florida second, Illinois third, and basically this tracks with population for the most part. I think for whatever reason Texas doesn't give data, so they don't show up on here because Texas is a big state and you would expect it to see it at the top. But anyways, this is not super surprising because, larger states are going to have more cases. This is a graph showing what percentage of the total cases are kids. So basically this shows you in which states are children a higher percentage of the COVID cases. And it's like Vermont, South Carolina, Alaska, Tennessee. Okay, here's the most interesting kind of data is cases per children. So what states are having the most number of kids infected based on their population. So it adjusts for population. So on a per population basis, the uh, the states with the highest number of children being infected are Tennessee, South Carolina, North Dakota, uh, Arkansas, and Rhode Island, West Virginia, Mississippi, Florida. Okay, and then this is the number of child COVID cases per week. So you see here's the big surge that was in around the holidays last year, and you see now the surge is bigger. So the Delta variant is very contagious, and so a lot of kids are getting it more than ever before. And then by region, you see that the South is experiencing the most. All right. So let's go down to the interesting stuff that we want to know. What is basically, we want to know the death rate and the hospitalization rate. So if you look at the hospitalization rate, it is about 1%. So about 1% of kids that test positive for COVID get hospitalized. And so, and that has stayed relatively constant. So if you look here, last week it was 0.9%, and then, several months ago it was 0.8, 0.9%. So it hasn't changed much. See, you can see we're going all the way back to um, December, and it stayed relatively close to 1%. It was a little higher early on, and that's probably because the testing was less. So you were only testing the really sick kids, so it artificially makes it look like the hospitalization rate is higher. Because when you test only the sick kids, obviously more of the really sick kids are going to end up in the hospital. So I suspect that this shows that the hospitalization rate has been relatively stable at about 1% for the whole pandemic, and the different variants don't seem to cause increased hospitalization. Okay, so let's look at death rate. Percent of child cases resulting in death, it's 0.01%, and that has stayed relatively stable over the years. I mean, over the past several months, so 0.01%. And then early on, remember the testing was only in severe cases, so it bumps up a little higher at 0.02%. All right, so that's the data that we need to get out of this, the public health data, is that hospitalization rates for children are about 1%, and death is 100 times less than that, so 0.01%. And this is for all children, from infants all the way to age 18. We don't have the data subsetted out to the age 5 through 11. And probably the age 5 through 11 is the group that does the best out of the kids. As we'll go over in these papers, but basically the kids that do worse amongst the kid group are infants, babies, and kind of teenagers. They do a little bit worse. Okay, so what are the underlying medical conditions that predispose kids to get hospitalized? Is it just all kids that get infected? Is it 1% of all kids? No, that's not true, because kids that have some underlying health conditions are more likely. So if you have a healthy kid, their chances of being hospitalized is even less than 1%. Okay, and this paper looked at 43,000 kids under age 18 that were tested and positive for COVID-19. And they got this data from basically looking at hospital records and insurance records. So it's a little bit different than the data set that we looked at from the American Academy of Pediatrics. This is all tested kids, and a lot of the testing happens through like public health services. This is kids that were tested usually in their pediatrician's office or through a hospital. So generally, these kids are going to be a little bit sicker than all comers. They're going to have a little bit more severe disease because the parents were worried enough to take them to the doctor, and that elicited a doctor's appointment and an insurance payment. So that's where they're getting this data from. So understand that the data is a little bit different between the two. And what they show basically is that um, the the things that are the strongest risk factors for hospitalization are type 1 diabetes, and that's an adjusted risk ratio of 4.6. So that means kids with type 1 diabetes are almost 5 times as likely to be admitted to the hospital, and obesity with an adjusted risk ratio of 3. So they are 3 times more likely, so 300% more likely. And then for strong risk factors for severe disease, so that means they have to probably go to the ICU or require much more treatment. It's type 1 diabetes, and kids with cardiac and circulatory congenital anomalies. So if kids that have heart problems, they're going to have more severe disease. This all makes sense. So if you are a healthy kid, not obese, does not have type 1 diabetes, and does not have any like cardiac problems, you are 3 to 5 times less likely to be admitted. And then this is another paper. In this paper, they looked at all the data out of England for the first year of the pandemic. So from March of 2020 to February of 2021. And then so during this time period, 3,105 children died of all causes in England. 61 of them died while they tested positive for COVID. And out of this 61, 25 of them actually died because of COVID, not because of something else. See, so that means like about, 36 of these kids had COVID, but it was something else that caused them to die, unfortunately. And then of the 25, 22 died from acute infection and 3 from PIMS. So I think this is the multi-system inflammatory disease. So 99.995% of these children, so CYP is their abbreviation for children and young people, with a positive COVID test survived. So that means only 5 out of 100,000 children died from COVID-19. So that's 1 in 20,000. So in England, during this first year, the chance of a kid who got COVID, dying of COVID, was 1 in 20,000. And then these 25 that died of COVID equates to a mortality rate of 2 per million. Okay, so this is something that like I see so commonly misinterpreted in the literature. They'll take this sentence and say, "Oh, your chance of dying if you're a kid is 2 in a million." No, that's not what it's saying. It's saying that 2 out of the million kids living in England died of COVID-19, not 2 per million that got infected out of the because not every kid in England got infected, and so if you look at just the kids that got infected, if you if you got infected, your chance of dying was 1 in 20,000. If you were just a kid living in England, your chance of dying from COVID was 2 per in a per million. Okay, so you guys see the difference there. But I see this kind of data like misinterpreted in the popular press all the time, and someone will read this and say, "Oh, your chance of dying from COVID is 2 in a million," which is kind of true, but it makes it sound like if your chance of dying if you're a kid and you get infected with COVID is 2 in a million, which is not true. It's 1 in 20,000, according to this paper. Then the things that made it more likely that you would die was that if you were older than 10 years old, of Asian or Black ethnic background, and if you had comorbidities. All right. So let's summarize so far what we know. About 1% are hospitalized. About 0.01% die. In America, in England, it was like 1 in 20,000. And if you are older, if you're an older kid, you're slightly more likely. And if you're a minority child, you're slightly more likely. And if you have comorbidities, mainly diabetes, obesity, and cardiac anomalies, you're more likely. So basically, if you're a kid under 10, not ethnic minority, you don't have comorbidities, your chances are all less than those numbers. It's less than 1 in 20,000. It's less than 1% more hospitalization rate. It's less than 0.1. All right. So the other thing we want to know is, death and hospitalization aren't the only bad things that can happen from COVID. The other bad thing that can happen from COVID is something called long COVID. And this is a paper where they looked at children that were hospitalized between April and August, and then they called them afterward and asked them if they had persistent symptoms. So remember, these are kids that were hospitalized. This is not all kids. So these are kids that had more severe disease. So this is basically interviewing the 1% of children that are admitted to the hospital. So of these kids, when they followed up with them almost a year afterward, about a quarter of them had persistent symptoms, of which the most common were fatigue, sleep disturbance, and sensory problems. Sensory problems most likely meaning taste or smell disturbance. And most of the multiple symptoms were experienced by 8%. So what this means is almost a year after hospitalization, a quarter of these kids still have persistent problems. That's a fairly large amount. And then this is another paper out of Italy. And in this paper, they looked at all children, not children that were just hospitalized, but children that just saw the doctor. So in this paper, they found that over half of the kids had persistent symptoms. So 42% were completely recovered. They didn't have any symptoms whatsoever after they recovered. But the other, like almost 60% of them had some symptoms. And the most common symptoms were insomnia, respiratory symptoms, including pain and chest tightness, nasal congestion, fatigue, muscle and joint pain, and concentration difficulties. So a lot, but the difference is they checked these kids about 60 days afterwards. So many of these kids might have recovered further if you gave them a little more time. The average was 162 days. So not quite as long as the previous study. So given a little more time, maybe more of them recovered. But this means like a significant number of children were having some side effects after having COVID, those that had symptoms. Okay, so let's summarize. What is the, oh, and here's the other interesting thing. So in here, about 5% of the kids were hospitalized and about 3% um, needed ICU, and about 1.6% got myocarditis. I'm going to do another video about myocarditis because myocarditis is one of the known bad side effects of vaccines, especially in children. So we kind of need to compare the myocarditis rates of COVID and the vaccine. Okay, but let's summarize what we found out today. About 1% of children get hospitalized. Why is this 5%? That's because these are kids that were actually uh, kids that were sick enough to go see the doctor. So if you're sick enough to go see the doctor, you're about 5% likely to be hospitalized. All kids, because a lot of the kids are just totally symptomatic or just have very mild disease that parents just feel like they can handle at home and they don't need to go see the doctor. If out of all kids in America, at least, it's about 1% hospitalization rate, 0.01% death rate um, in America, and it's probably less than that because that's just the smallest number they get put in that category. If you go by the data out of England, it's 1 in 20,000, and that's for all kids. That includes kids with comorbidities. So the comorbidities that seem to be the most important are obesity, type 1 diabetes, and congenital heart problems. So if you're a kid and you don't have those issues, your chance of these bad things happening is even less. And then anywhere from 25 to 60% of children have persistent symptoms if they have symptomatic disease. So that's a pretty big number. And so those are the risks that we need to think about in kids. Generally, the 5 to 11-year-old group is probably the handles COVID the best. So in that group, all these numbers are probably even lower than what we talked about because these numbers include all children. Okay, so just keep those in that risk profile in mind, and then we'll go over the clinical trial data and the risks of the vaccination, and then people can make an informed decision on whether they feel like vaccinating 5 to 11-year-olds makes sense for them. All right, thanks for watching.